Thank you, Marty. Talking to us about some of the leadership challenges that we've come across when we've been doing the Sympathy Project. And I guess the biggest one really is about applying the lessons from sympathy and applying it across organisations that work very differently, have very different ways of delivering healthcare. Could you give us some advice and insight into how we might deal with that?
Well, I think let's start from a general proposition, which is the way things are is not an accident. It's the way people want them to be, sometimes explicitly, sometimes implicitly. So when you're pushing against that, you're pushing against a status quo that has a lot of power behind it, a lot of staying power. Right? So in order to get people to change the way they do business, in your situation, to collaborate more closely on delivering coordinated, integrated healthcare, particularly around the polypharmacy issue, you've got to understand first why they like the system the way it is, what benefits, and then second, what they are afraid of losing if change should come about. I think a lot of the resistance comes from a sense of identity and autonomy, and people and organizations fear that if they collaborate or if they give up their way of doing business, they will be indistinct in the universe. So trying to understand what is most important to organizations, and it may be their name and it may be particular practices, that seems to me to be a place to start. Leadership is, diagnosis is undervalued as a leadership competence. And trying to understand what the current reality is all about, what the resistance is all about, seems to me to be the place to start.
So you talked about people holding on to things that they've got a vested interest in, maybe. How do you change that culture?
Well, it's a combination of carrots and sticks, you know, and it's not one size fits all. So for some people, for some organizations, greater collaboration will mean maybe more financial security. That's what they're interested in. They're worried about survival. And so trying to think about how you can provide them more financial security would be a way to think about it. For some organizations, it will be that they've been doing it their way for 50 years and that the people on the top of the organization are comfortable with that. And so helping them, you may have to bribe them. I don't use that word in the criminal sense, but I use it in the sense in which we bribe our kids sometimes. You know, if you get great grades, you'll get this reward at the end. So for some people, it is going to, it will be quite personal. That is, if you get, if someone wants to get to me, right, in this community, they know that the way to get to me is to get to you first, right? And so another way of thinking about it is looking at the networks and the connections among people. And they don't have to be professional, they can be personal. You know, begin to decide, well, who in the organization knows the CEO? Who speaks to the CEO or the executive director? Who does she rely on or trust? And then maybe if that person is interested in what you're doing, that's a way to get to that person rather than trying to go directly. Does that make sense?
Yeah, no, that does make sense. So I suppose the situation is quite complex because we're talking about delivering something that should be of high quality. It will address the economic challenges, but it also meet the political and that may be driven by public demands and needs. And in the climate that we're in just now, which is, the economy is constrained, how do we deal with all of that tension to make sure that what we deliver is good quality outcomes for our patients?
Well, I think there's a danger of having a vision of what good quality outcomes are, which is actually constraining. Because good quality outcomes can be at different levels and they can take different forms. To me, the most powerful driver of change in this particular issue are the patients themselves. Because if patients don't want what you are proposing, it's not going to happen, I don't think. So I think a key element of your strategy going forward is the mobilization of patients. I was thinking with the woman who was the COO of the hospital, right, and her frustration, and trying to think about how she could mobilize the patients from that hospital to put pressure on the doctors and the nurses and the social workers to operate in a different kind of way, to be more collaborative. I think that will be a big driver of change.
So I suppose there's a few other things here that make me think that, we've talked about collaboration as well. So there's collaboration in lots of different ways, and I just wonder whether you could speak a bit about that. So firstly, there's a collaboration between healthcare professionals.
Yes.
And it's that cross-professional collaboration that there seems to be a bit of resistance in some parts of Europe to change. Can you say a bit more about that?
I think it's not surprising. Certainly in my experience and observation, doctors are the priests of the system. And they're very conscious of that role and that status. To the extent if they collaborate with nurses and pharmacists, for some doctors, particularly I think for older doctors, it will feel like a diminution of their identity and autonomy. So I would, for example, try to find doctors who used to be nurses, or pharmacists with an MD degree. Begin to see how approaching the medical community, the physician community, without wagging your finger at them and telling them the right thing to do, but trying to engage them where they look at the world, because they'll talk to a person with an MD degree differently than they will talk to a person with a nursing degree. So beginning to think about, then the other thing related to that is if you have a group of physicians who are really acolytes, who are really on your page, they can do a lot in the physician community to break down that resistance, because people will take stories from them, anecdotes from them. I guess one of the things I'm pushing against, Alpena, is the assumption that just because you're right on the merits, that means progress is going to happen. Because I don't think that's true. Because what you're proposing feels to me to be obvious. That it's not controversial. It's not controversial. It's obvious. What's controversial is what it would take to implement it, because it's going to force people to change the way they do business.
So you've talked about talking, getting a medic to talk to a medic. But beyond that, how do you then take that forward? So how do you take a bit of success and do that at scale? Well,
you've got to you talk a lot about going to scale, and I understand that, and I'm sympathetic to it. My instinct is that going to scale is going to look very messy. It's going to look like a lot of different experiments, some which aren't going to work, some which are going to work. It's going to feel like in some places you're taking a step backward before you take a step forward. So I would encourage you to, rather than think about a shared image of what a future would look like, to think about running multiple experiments. And anytime you get anybody interested, anybody at any level in any organization, the people who have signed that call to action, you want to be as customized as possible in saying to them, look, let's talk about where you are in the system and what you could do tomorrow. Maybe it's make a phone call, maybe it's call a meeting, maybe it's make a connection with people in another facility. Everybody has something they could do that would move this forward.
That's really encouraging for me to hear that, because I think that even within the Sympathy Consortium, what's happened for countries that didn't have a program, they've started to have a conversation.
Yes.
And I'm a real believer that actually experimentation should provide that safe space for people to try good ideas.
Yes.
And to learn from things that don't work.
Yes.
But also learn from things that go well, but to share the things that go well. And then I'm thinking, when the things do go well, and you then do want to put these into place, what stops it from just becoming another project? How do you make sure that it gets embedded into daily practice? You know, a bit like we might go for our regular checkups, so that as part of my routine care, if I've got long-term illnesses, I know that I'm going to benefit from a medicines review. So how do I make sure that that's part of day-to-day practice?
Well, if you're talking specifically about a medicine review, first of all, a medicine review can take lots of different forms.
Yeah.
And it can be done in different ways by different people. Okay, so if you would like to see medicine reviews become more standard operating procedure in healthcare delivery, right? I would encourage you to run as many experiments as you can, and so you can begin to develop a body of experience in which people can say, well, we can't do that in our facility or in our system, but we could do this. Let's try that.
Yeah.
So you give people options so that they can begin to take from your experiments what might work in their context.
Yeah, okay. So we've talked about the professionals working together, and one of the things that we found from Sympathy was where there were programs in place, it tended to be because of the clinical and policymaker collaboration.
Yes.
How do you ensure that can happen? How do you enable that, and is that important?
Well, I think it's particularly important as you move up the policy-making level and get close to the political class, because unless there are policies and particularly allocation of resources to support this, for example, it would be interesting if there was I'm just playing now, if there was a EU award for the most important collaboration around polypharmacy, right? That would be some kind of an incentive. I think the more you can begin to think about ways of creating both pressure on the system. At the political level, it's really got to come from the public. People aren't going to change. Health ministers and their senior civil servant deputies are not going to change the way of doing business because it's the right thing to do. They're going to change the way of doing business because it's a politically sensible thing to do. And that requires mobilization of people. And I think one of the great assets that you have is you've got, particularly at this moment in history, you've got a elderly population that is huge, and they're going to be increasingly interested in getting good health care and in avoiding the kind of polypharmacy chaos that our parents lived through. So trying to begin to get communities, I mean, in the U.S., it would be the AARP, it would be the interest groups, the advocacy groups for elderly people, trying to get them mobilized so that this becomes a priority for them would go a long way to getting the policymakers' attention.
Yeah, okay.
See, once you get policymakers, the health ministers, the deputy health ministers, to have this on their screens, everything else will happen okay. Right?
Yeah. So I suppose that sort of leads me on to the other question is, you can be making good progress, and then people come in that maybe don't have the same vision and interests that you do, and they try and destabilize things. And then maybe from a leadership perspective, I guess it would be good to understand, is there something that a leader should be doing? Or somebody that's, you talked about leadership being at all levels of organisations. Everyone's a leader in what they do. What is it that an individual can do to try and minimise taking us off the track, I guess?
Well, I think the danger is to try for any one person to try to do it himself or herself. So if you're an advocate for better managed polypharmacy, Alpina's convinced you, right? And you see the forces in your organization, in your ministry, beginning to push against it or to keep the status quo. Then you begin to look for allies. Who are the people in the system who will benefit if we make more progress? And who are the people outside the system who could influence people in the system? Then the flip side of that is when people push back, when people resist the progress that you think is important, trying to understand what they're afraid of. What are they worried about? And then if you can begin to think about how you can help them deal with those fears, which may be sometimes just acknowledging them. Some people who resist progress, all they want you to acknowledge is that this is going to be difficult for them, or that they stand to lose something in this. Some people, that's all they want. Other people, they want actual help. If I'm going to go through this, I need some support and help. Well, what kind of support do you need and help in order to get through it? And that's why I keep suggesting that this is a customized process. It's a retail process, not a wholesale process. And I know you can't deal with that at the level, although maybe you can in Scotland, but you can't deal with that at the European level. But Alpina's all over Europe can do that, to begin to see where that resistance is coming from, what its source is, and how you can attend to it.
Yeah.
I mean, if you look at the politics in the big picture, where we are now, so much of the extremist politics in Europe, as in the U.S., comes from people who don't think their fears have been acknowledged. That's what it comes from. Is it people who were told to suck it up and get going, get with the program, and the resistance comes from people who they don't have to be convinced that the arguments are strong. They have to be convinced that they're going to be okay on the other side.
And I'm going to ask you a question that I know it's not just a one answer, but I'm going to ask it anyway. So when you're trying to deliver change that like this, that's culturally challenging, politically challenging, what leadership qualities should you have? What kind of a leader should you be?
Well, what kind of leadership qualities? I like that question better than what kind of a leader should you be. So one quality is to be not take anything personally. Because when you're out there trying to lead change, people are going to come at you in whatever way they think will get you to pull back, right? If it's criticizing you personally, if it's criticizing you publicly, whatever it is, people will try to get you to pull back whatever way they think they can. It's important when stuff comes at you. By the way, it's both bad stuff and good stuff. When people tell you how fabulous you are, and there's a little voice in your head that says, I'm terrific, but I'm not that terrific, right? That's the same thing as when people are criticizing you. In your professional life, when people come at you personally, positively or negatively, it's not about you. It's about what you represent to them. If you respond personally, then you're colluding with them in taking you off your game plan. Okay. So not taking it personally, I think, is a big thing. Being relentless is another thing. That is, if people think that after they shove you twice, you'll back off, they'll shove you twice. And convincing people that you're in this for the long haul, right, isn't important. So relentlessness, I think, is a high value. The other point, which I think is even a harder one to make, is that you've got to be willing to do some things that make you uncomfortable. If you keep operating in a very consistent, predictable way, it's very easy for people to work around you or to push you aside. So you have to be willing to operate in ways that are less predictable, less consistent. Predictability and consistency are wonderful virtues for management. unpredictability and inconsistency are virtues for leadership. Because the more people know exactly how you're going to react, the more people can figure out how to resist what you're trying to accomplish.
So I guess finally, I would just like to hear your thoughts on this whole issue and how leadership plays into it. Because I'm sure there's things that I haven't thought about that you have an insight into or that you've reflected on from the discussions that we've had.
Well, for example, it's really critical to engage people from the finance ministries because they're going to be interested, you're interested in better care for the patients. That's what your goal is. They're interested in saving money, right? There are real prospects of financial savings if your vision is implemented. You can't ask them to care about patients. You can ask them to care about money. So I would think involving the finance people is a really important step. Similarly with patient advocacy organizations, similarly with elderly organizations. I would also think that younger health professionals who have been trained differently than people in their 50s and 60s are going to be more open, although they have the less direct contact. Now, it is also my assumption that any health professional, most health professionals in their 20s and 30s and early 40s have elderly parents, right? And that's another way to get through them. For example, and I mean this quite literally, you know, if you are trying to influence a policymaker or a senior authority in a healthcare organization or in a finance organization, and you know that he or she is spending a lot of time helping an elderly parent or elderly parents cope, they would be very open to something that was going to make that piece of their lives easier. So I think getting as personal as you can, trying to figure out where the pressure points are, thinking of stakeholders in a broad rather than a narrow way, opens up some possibilities for coalitions and allies that aren't obvious if you just think of this as a patient care issue.
Well, that's very helpful. Are there any generalized abilities from, I mean, you've talked about some of this right now in terms of feedback to people, what's important to them. I think that's what I'm hearing you're saying. But are there any, what else could we take and apply? You know, what other general principles could individuals that are trying to affect change apply in difficult change environments? So you've talked about getting your message right, but what else should we be doing?
Well, for example, I was thinking about the woman from Greece who's the CEO of a hospital. What if she made it part of the performance review of all her employees that they had to show evidence of collaboration across professional boundaries, right? My guess is that's not part of the performance review in most organizations for most employees. That would be a good step forward, right? Now, it has nothing directly to do with this issue, but it's something that a CEO of an organization probably has some authority to implement, and it would be a step in the right direction. It's not a straight line from where we are now to where you want to be.
Yeah.
You know, it's going to be a crooked path.
So is it something that we can legislate for? So earlier on I was in a meeting and people were talking about Europe really recognising that actually we need to work in a much more collaborative way. Is it something that you can legislate for?
I think it's very difficult to do. If you had a European Commission or a Prime Minister of France or Germany who was really excited about this, maybe yes. I think starting at the macro policy level is really, really hard unless you have some burning platform or some ready-made advocate. So, for example, if there were I'm just playing now, but if the next prime minister of France was a nurse, that would be someone I'd want to spend a lot of time with around this issue. Okay. I think that's a hard way to go. To me, this is an issue in which is going to require some patience on your part, to let 1,000 flowers bloom, look for targets of opportunity, see moments where a region or a city or a country is in some kind of financial crisis, that you can be the financial savior. If you see an article in a paper about a person dying because of multiple medications or something like that, I would circulate that as widely as possible. I think the testimony of the personal testimony of some of the people in your success stories would be really useful, because they can communicate to their peers in other places. To me, it's as many different things you can do, but to start at the macro level seems to be the hardest road to go.
I'd really like to thank you, Marty, for your insights, because I think
I hope it's
been
useful,
really
Alpine. I think you're doing important work, so it's great. Thank you.
Thank you.